Rabies is one of the oldest and most feared infectious diseases known to man. Yet, it is also one of the most preventable. It is fatal, yes, but preventable viral disease, transmitted through animal bites, primarily by dogs. The Department of Health, together with the Department of Agriculture, the Department of Education, and the local government units lead the National Rabies Prevention and Control Program. This program envisions a rabies free Philippines, recognizing that success requires multi sectoral collaboration from veterinary services to community education. Rabies claim 200 to 300 Filipino lives every year, despite being 100% preventable. Most of these deaths result from dog bites, compounded by inadequate post exposure management, meaning victims do not receive proper wound care or vaccination after being bitten. Children under 15 years old are the most frequent victims because of their natural tendency to play with animals and their lack of awareness about bite risks. This is why public health education, especially in schools, is one of the strongest tools for rabies prevention. According to the Department of Health, while cases have decreased over the years, stray and unvaccinated dogs remain the main source of human rabies infection in the country. Rabies is caused by the rabies virus, belonging to the genus Lisa virus. The virus is transmitted through the saliva of infected animals, commonly dogs, and less frequent cats, bats, or other wild animals. Entry occurs through bites, scratches, or exposure of broken skin and mucous membranes to infected saliva. Once the virus enters the body, it travels through the nerves toward the brain, causing inflammation and eventually death. Wild and domestic dogs serve as the main reservoir in the Philippines. This highlights why dog vaccination is not just a pet owner's responsibility, it is a public health necessity. Rabies develops in stages. Early symptoms include fever, headache, and discomfort at the bite site, which might be easily ignored. As the disease progresses, more severe neurological symptoms appear, such as hydrophobia or fear of water, agitation, confusion, and paralysis. Unfortunately, rabies is nearly 100% fatal once clinical signs appear. Death typically occurs within days of symptom onset. This underscores the critical message nurses must always convey. Rabies is preventable before symptoms appear, but untreatable after. Rabies is primarily diagnosed clinically based on the patient's history of animal exposure and characteristic symptoms. However, the cornerstone of rabies prevention is post exposure prophylaxis, or the PEP, which is life saving when administered promptly after a bite. PEP involves immediate wound cleansing with soap and running water, followed by anti rabies vaccination, and in severe cases, administration of rabies immunoglobulin, or RIG. Effective prevention requires prompt evidence based community level interventions. Public health nurses must ensure that every bite victim understands the urgency of seeking care within 24 hours after exposure. Education, immediate first aid, and vaccination are key to survival. Prevention always begins with responsible pet ownership. Routine vaccination of dogs and cats is the most effective strategy for eliminating rabies transmission. The DOH and DA jointly conduct mass dog vaccination campaigns each year, especially in high risk areas. Prompt reporting of animal bites to health centers ensures that victims receive timely treatment and that cases are properly documented for surveillance. At the policy level, coordination between DOH and DA strengthens animal bite management and stray dogs or stray animal control measures. Community enforcement of Republic Act 9482, or the Anti Rabies Act of 2007, also supports these efforts, emphasizing pet registration, vaccination, and leash laws. Education is one of the most powerful weapons we have against rabies. We nurses educate communities about proper bite management, which includes immediate washing of the wound and seeking medical care. We also promote vaccination campaigns and awareness drives, especially in schools where children are taught how to interact safely with animals. Simple messages like hugas, turok, iwas rabies make health promotion memorable. PHNs must also combat myths, such as putting garlic or vinegar on bite wounds, which can delay proper treatment. Instead, we emphasize that only vaccination and wound care can save lives. PHNs play a vital role in rabies prevention and control. We conduct health education sessions in barangays, schools, and workplaces to raise awareness about bite prevention and vaccination. We also perform bite surveillance, tracking and reporting animal bite cases to local and national health offices. We coordinate with veterinary and education sectors to ensure animal vaccination and rabies education are sustained. In addition, we follow up on vaccinated patients, verify completion of PEP schedules, and maintain accurate records. We are the bridge between health systems and communities, ensuring that no potential rabies case is left unaddressed. In summary, rabies is 100% preventable through timely vaccination, early bite management, and strong public health education. We nurses play a central role in awareness, surveillance, and coordination with other sectors. The key to success of this program lies in intersectoral collaboration between the health, agriculture, and education sectors, supported by engaged local governments and responsible citizens. If every community actively participates, the vision of a rabies free Philippines can become a reality. Remember, one bite, one life. Act fast, vaccinate, and educate.